Hello and welcome to Rolling Out's Health IQ. My name is Portia Monique, and today we have the beautiful guest, Shamiracle Rankin, who is an attorney at the CP Law Group, and she also attended Spelman College and the University of Georgia Law School. Welcome to the show, Shamiracle.
Thank you for having me, Portia.
Absolutely. Now, today we're going to talk about your journey with breast cancer, and of course, October is Breast Cancer Awareness Month. So we want to highlight and target some women who have overcome some of these tragedies and turned them into triumphs. So let's go ahead and get started with your story. But I want people to know what it is that you do now as an attorney, and then we'll jump right into your journey.
I'm a partner at the CP Law Group in Atlanta, Georgia. And in that role, I oversee our firm's litigation department. We litigate cases and represent individuals who have been injured due to the harm of others. So I find great value in being able to be a voice to individuals who oftentimes feel like they're voiceless, who come to us in their darkest hours, to be able to shepherd them through the process and advocate on their behalf and bring some semblance of wholeness back to their lives. It's been a true pleasure for me.
I love that. Tell people where they can find your website as well, because I know we're going to go deep into your story, and I just want people to be able to find you if they want to right now. And then, I just want people to be able to find you and your socials as well.
Okay. www.thecplawgroup.com. I'm on Facebook as Miracle Johnson Rankin, and on Instagram as She's a Milagros, that's miracle in Spanish, and LinkedIn under Shamiracle Johnson Rankin.
Well, that's right. You got the perfect name, Shamiracle, because listening to your journey backstage is absolutely a miracle that you are here with us today. So let's go ahead and get started with it. The old cliche is correct. Black does not crack. And you are looking at Shamiracle, who is a very young woman. She looked like she might be about 25, y'all. But
you.
Absolutely. But she's absolutely a 37-year-old breast cancer survivor. And you may think that 37 is young to be a survivor. So tell us from the beginning, at what age were you diagnosed? How did you find out? And then we'll get into some of your journey in terms of what you had to go through.
Certainly. I was diagnosed at age 32. My mother is a breast cancer advocate, and for years she had put on seminars about knowing your breast and being able to early detect if something is going on. So monthly, it was a part of my routine to do self-breast exams. And it was towards the end of October when I did a self-breast exam and I felt a lump. And I naively thought, well, you've been working out a lot, so maybe you just pulled a muscle. But after 2 weeks, the lump was still there. It didn't move. So I scheduled an appointment with my OBGYN, and she sent me through a bunch of diagnostic tests, including a mammogram, CTs, ultrasounds. And it was ultimately determined that I did have stage 1 breast cancer in my right breast.
Stage 1 breast cancer. Now, so your mom owned a boutique, but did breast cancer run in your family? Why did she own this boutique? Why was it important to her to own this boutique?
Her aunt died of breast cancer about 15 years before I was diagnosed. And it was important for my mom to open up a medical supplies, Mercy Medical Supply and Mastectomy boutique, because she wanted to educate women about early detection, about things that are out there from a resource perspective when you actually do have breast cancer, because a lot of women, especially when you get older and you're diagnosed, it can be very difficult to part ways with your breast. That's a part of your identity, a part of yourself. And the small town that we were from in Louisiana, it's not a conversation that was frequently had at that time about breast cancer awareness. and what happens next. Like we hear about October, but what actually happens when you get the diagnosis? And so it was important to her to be that awareness point for people in our hometown and then people locally that she served as well.
Now, walk us through what it was like for you after you got that diagnosis.
It was shocking because it was not just shocking to me, but also to my medical providers. I was 32 years old. I meal prepped and meal planned. I worked out. I played tennis. I was in the tennis league. I
Just
was
a bill of health.
I
Yeah.
was. I was
Mhm.
extremely fit. And
Mhm.
so to be very fit, to be healthy and health conscious, and then to be diagnosed with cancer, everyone was like puzzled. In fact, my then OBGYN had to call me after I received the diagnosis because she had convinced herself and me that it was likely a benign cyst. And so
Mm.
to go from it being a benign cyst to, well, no, it's actually breast cancer and you have a treatment plan that you need to go forward with was a shocker for everyone.
Yeah. Now, what did that treatment plan look like? So you're 32, you get this diagnosis, your OBGYN, she calls you, and you guys have to go through this treatment list. What did it look like?
So I was given a few options. One, the type of cancer that I had, it surrounded my milk ducts in my breast. And so given the size of the lump, as well as the size of my overall breasts, which were pretty small, the lump took up about 75% of my breast mass tissue. And
Wow.
so my doctor suggested a few options. One, you can do a lumpectomy, which means 75% of my breast tissue would have been removed. Um, and you would just have a partial breast. You can do a one-sided mastectomy, meaning that they take out all the breast tissue in that area. If I would have gone the route of the lumpectomy or the one-sided mastectomy, chemo and radiation would have been also a part of the treatment plan. And then the other option was to do a double mastectomy, where they took out the breast tissue in both breasts and then used implants if I decided that I wanted to have implants placed. I chose the third route, which was the
Mhm.
double mastectomy. The cancer type that I had, so you hear breast cancer, breast cancer, breast cancer, but there are actually types within the actual cancer category itself. And so I was diagnosed with a type of cancer that was seen most frequently in postmenopausal women, but I was 32. So since it was seen in postmenopausal women, my doctor was very concerned about the high reoccurrence rate. And I knew that hopefully one day I wanted to start a family, get married, and I did not want to have that constant concern or fear looming over my head of would it come back and would it come back more aggressively. So I decided to take a very aggressive treatment plan on the front end, which was the double mastectomy and then immediate revision surgery.
So with the double mastectomy, did you have to undergo chemo with that?
I did not, because they cleared out all of my breast tissue on both sides. And after they took out the cancerous lump, they were able to confirm that it was only localized to that area, and that it wasn't infecting the other tissue around it, because in that instance, I would have had to go through chemo and radiation. And like I said, if I would have done a lumpectomy, I would have had to do chemo and radiation. But with the mastectomy, I did not.
What a warrior and what a miracle, right? Um, let's go through the emotions after you got the double mastectomy. So you were explaining a procedure in which they do the double mastectomy and then they immediately fit you with breast implants.
Correct.
Okay, now that's the procedure that you underwent, right? Is that correct?
I did.
Okay.
And again, I think I tend to be a person that when I'm faced with an obstacle, I meet it head on and just try to get through it. And so when I was given this as an option of we can go straight to immediate revision, I said, okay, this will be a great way to get through with having breast cancer and get to the other side. I didn't really take into consideration the success rates with it. and any potential risk or complications. And so what should have been one surgical procedure turned into 7 surgical procedures, including one that was a life-saving procedure, because in that process, anyone that knows, you don't really want to keep getting cut on, because every time that you get cut on, it increases your risk for an ultimately untoward event or infection. And I developed an infection in one of the breasts, and that led me to being septic and going into septic shock, and then them having to essentially undo everything that they'd done before to try to clear the septic shock and infection out of my system.
So that was a setback. However, it was also a setup because because you came out victorious, right? So
Correct.
walk us through what happened after that.
So during this time, so when I first got diagnosed with breast cancer, I was dating my then husband. So he was my boyfriend. He actually proposed a month after I had my double mastectomy. So on January 17th of 17, he asked me to be his wife. And during all of this, we are planning our wedding for that following August. So we got married on August the 12th of that year. And that helped to kind of take my mind off of everything that I was going through from a treatment perspective. One of the biggest questions that I did have for my providers when I first got diagnosed was, how will this affect my ability to have a family? If I go the double mastectomy route and I ultimately have babies, I won't be able to breastfeed. So I had to kind of come to my own terms with what all of that meant for me, and what that meant for my family, risk that my husband was taking, because we didn't know if it would affect my fertility, because frankly, that's not something that you really know until you start trying. So
Right.
those were all concerns, but we have fortunately made it to the other side of that. And we do have a family, and we are very blessed and fortunate that we were able to conceive not once, but
Not
twice.
once, but twice. Congratulations on that. Like I said, your name is truly, it's truly indicative of who you are, which is a miracle, because you had to undergo all of this at such a young age, 32. And God saw fit that he provided you with a husband, and you still were able to live your dreams, and you still were able to have a family. Let's talk about that support system, because I know when people are diagnosed with cancer or any disease and surgery that they have to undergo, support is a huge factor in them recovering, right? So let's talk about your support system and how that helped you to recover.
My support system was absolutely amazing. It truly takes a village to get through a life-altering diagnosis. And so from my parents to my brother, my husband, his family stepped in, and my closest girlfriends and my close male friends. You really find out who is in your corner. I say when you are having times of celebration, and when you're also having times of where you have trials. And this was a trial for me, but they pitched in, be it meal trains, taking me to appointments and doctor's visits, coming over just to make me laugh. And some just allowed me to lay on their shoulder and boo-hoo cry. Reminding me of the importance of, I didn't have to be a superwoman, that it's okay to not be okay, was something that I needed to be personally reminded of, because like I said, I try to just go through it. And when you go through something and bury your head and just get through it, a lot of times you don't have a moment to sit and deal with what is it really feeling like for you. So I had to actually mourn the loss of my breast. And it took some of my friends to say, that's okay for you to not be okay with losing something that you've had for so very long. So my support system was just very integral to being there for me. And they were there for me every step of the way. And they continue to be here for me. And so they have seen me through my entire journey.
Such a heartwarming journey indeed, Shamiracle. Before we get out of here, I also want to talk about how you went through anxiety. And the ups and downs of your self-esteem. There are plenty of women who are going to see this, and some of them may be going through some of the things that you had to endure as well. But let's talk about how your self-esteem took a hit and the things that you did and the things that your support system also helped you to do to come back on the upswing. And then let's talk about the anxiety as well and how you dealt with that.
No, certainly. One, I think you have to just come to grips with that aspect. So with regard to the self-esteem portion, I can remember my best friend and I when we were 12, 10, 11, 12, and trying to figure out what will our breasts look like one day? Will I have big ones? Will they be small? Things that you
I think we all went through that, right? I'm laughing because I can identify, because of course I had a set of girlfriends as well. It was like, yours ain't small, yours not big, yours small, mine big. So right. I understand that, right?
And I was a late bloomer, right? So I was late to the party. All my friends had boobs. And I'm like, well, I'm going to have them one day. And you never really think about, well, what if they fail me, right? Like, what if they don't do what they're supposed to do? And years later, they did, right? They were things that were very personal to me and that I thought were my friends. And they ultimately turned into something that could have been very deadly. And having to come to grips with departing from something that I had anticipated for so long was something that takes a hit on your self-esteem. Like, how will I look when I look in the mirror again? How will these new implants feel? How will they function? I don't know them. So that was a shocking moment for me. The first time that I saw myself, frankly, without all of the bandages and wrappings, and had to see the scars and what my new normal looked like. But like I said, I had to give myself the grace and the space to admit that that was a concern. And I did that by counseling. So I would definitely encourage you to seek counseling. The state bar allows us to have counseling sessions as attorneys. But aside from that, your health insurance also generally will provide for some level of therapy. So being okay with admitting that something is wrong with you and that you're trying to process your new set of emotions is perfectly warranted. The second thing that I had to really work myself through, and I still work myself through it a little bit now, is that I knew I wanted to have me some babies and I wouldn't be able to breastfeed. I'm a very organic person and I wanted to be able to provide that level of nutrition and support. And I had to really come to grips with that I would not be able to do that. With my son, it wasn't so hard because he was fine with formula. He didn't give me any issues. But I have a 2-month-old daughter and she has thank you.
You're welcome. Mm-hmm.
She has a sensitivity to formula. And we went through about 6 formulas until one day I was on the phone with one of my girlfriends who has a son who's 4 months old. And I was just complaining to her about how defeating it felt. And she said, well, I have some extra breast milk. Let's see if she likes my breast milk. And that was a blessing and also a reminder of this was something I couldn't provide. And so I had to really take myself out of myself and accept the blessing. And now my baby, she has breast mommies. And I have 3 girlfriends who in rotation provide me with breast milk for my daughter. And she has been thriving since she's been, on their milk. And so I just am always fortunate that God will see fit to give you what you need and to, fill in the gap for you. So I think he gave me my son first because he probably knew this girl would not be able to take this emotionally if she can't feed him. And then my daughter just also was a reminder of, while my breasts didn't work for me, they're working for plenty of women. And there are women out there who are just so selfless. And I am so appreciative of her breast mommies.
So I'm trying to hold back these tears, girl. And so when you said that your support system was amazing, like you really meant your support system was amazing because you got girlfriends that are helping you out to with breast milk to feed your baby girl. So what a blessing. What a blessing. And speaking of blessings, your breast cancer is in complete remission. And
Hallelujah.
hallelujah. So tell us what your oncologist said. Tell us what she said.
So the irony of it all is part of my cancer was responsive to estrogen. So I have to be very cognizant about my estrogen levels and not eating foods that have a lot of estrogen or hormones in them, right? Because it could feed cancer growth in your body. So naively, when I was going down the journey of pregnancy, I was so stressed about, Lord, please don't let me get pregnant with a little girl, because that's going to cause me to, produce more estrogen. So last year, I go to my oncologist every year, every October, for my yearly screenings. And as we were just chatting about life, and I'm showing him pictures of my son, and I said, oh, I was so nervous. I didn't want it to be a little girl because I just did not want more estrogen in my system. And he goes, huh? What are you talking about? I said, well, that would feed like anything going on in my body. I don't want cancer to come somewhere else. And he goes, you can have a little girl. I said, okay, well, they'll be in a couple years, doc. He says, okay. So 2 weeks later, y'all, I actually got conceived. Wasn't expecting it, but I conceived. And then later last year, found out I was pregnant with a little girl. So I guess we talked her up. But at my appointment this year, as we were doing our routine of going through how it was my family, his family, I showed him a picture of my daughter and my son. And we were like, we talked her up. Yeah. And all my blood work came back. I am healthy. My levels are great. It is clear that I'm doing what I need to do to continue to take care of myself, because I want to be here for a very long time, to love on my babies, hopefully love on their babies, and just here as long as God will allow me to grace our beautiful earth.
It's been an absolute pleasure speaking with you, Shamiracle. Give our audience some tips, or for women, right? So for even men, but give them some tips on how to look for symptoms, how to do self-examinations, and also what else should they be doing even as early as your early 30s.
So first, I'll start with some statistics. 1 in every 8 women are diagnosed with breast cancer. So if you have a group of 10 girlfriends, 2 of the 2 will likely, potentially have breast cancer at some point in their lifetime. And then 1 in every 800 men have breast cancer diagnosis. So it's not just limited to women. It is also men. I know men who are breast cancer survivors. For African-American women under 45, we have the highest occurrence of death rate. And the only thing that I can think of that makes it so is access to healthcare, and just the fear of knowing. And so the first thing that I would encourage you is to know yourself, know your body. And that means touch yourself to know your body. So know how your boobs feel, right? For women, there are kind of 2 different changes that we experience in our breasts. You have your breasts when you are not on your cycle, and you have your breasts and how they feel when you are on your cycle. You really need to know the difference. They don't encourage you to do self-breast exams when you're on your cycle, because you tend to be more lumpy and have tissue changes. So just be cognizant of how does that feel when you're on your cycle versus when you're not. And you'll notice when you're not, your breasts are a lot more smoother. So you're able to detect if you feel something that is odd. So do those monthly self-breast exam checks. Mentally schedule it that, I do it the second week of each month, or whatever your time period is, but put you on your calendar. And if you feel something, say something. I am just very fortunate that I did not put it at the back of my mind, like sometimes we can do when it comes to our healthcare. We put a lot of people before us, right? So don't let that be your story. If you feel that something is not right with your body, even if it's not your breast, it could be any other aspect of your body. Schedule an appointment with a medical provider. I cannot stress the importance of having medical providers that you feel comfortable with. After my previous OB did, kind of gave me false hope, I didn't really feel comfortable continuing with her post treatment. So I interview OBGYNs.
Mm-hmm.
I didn't even know that was a thing, right?
Mm-hmm.
But now my OBGYN, I think the absolute world of her. She
Mm-hmm.
has been so gracious with ushering my babies into this world and with just taking great care of me as a person. So
Mm-hmm.
find you some healthcare providers that you feel comfortable with, that you can be candid with,
Yeah.
because you need to talk to your doctors and tell them what's going on with you. Knowledge is power. And not knowing is power that you're taking away from yourself.
Mm-hmm.
So don't let ignorance be bliss. Find out what's going on with you and just take care of your body. You're only guaranteed one. So be kind to it, be kind to yourself.
Absolutely. It's been a wonderful, wonderful pleasure speaking with you today and learning about your journey. Thank you so much for taking out the time to stop by Rolling Out's Health IQ. Also, let's give your website again and drop your social so people can follow you on your journey as well on social media.
Yes, certainly. My website is www.thecplawgroup.com. That's THEC as in cat, P as in Paul, lawgroup.com. You can find me on Facebook under Miracle Johnson Rankin, Instagram at She's Milagros, and then on LinkedIn at Shamiracle Johnson Rankin.
Shamiracle Johnson Rankin. Thank you so much for your time today. We appreciate you. I'm sure your story is going to help a lot of women out there and men as well. Thank you again. Take care.
Thank
And thank you guys
you.
for tuning in to Rolling Out's Health IQ. Stay tuned for another episode. I'm your host, Portia Monique. Take care, guys.